Hi, welcome back to Everyday Behavior. My name is Mary Ann Shepard, and today we're talking about how to remove barriers that could lead to refusal, school refusal, truancy, or chronic absenteeism. And so when we're looking at those barriers to school attendance, you want to look at, are there any deficits and adaptive skills or learning skills, specifically those adaptive skills that could lead to a student or a child finding school punishing or wanting to escape or avoid school. If there are any kind of speech or communication delays, you want to refer to speech therapy. When you're looking at speech and communication delays, you don't want to just look at their articulation, but you also want to look at their development in their communication, their broad communication. So are they having trouble with joking, sarcasm, humor? Are they having trouble with receptive communication, being able to follow 2, 3-step directions or instructions? Being able to process what's being said? Are they having difficulty with expressing their thoughts and formulating those sentences or kind of that word finding, getting things from their brain out into their mouth? Are they having difficulty describing their day? And so things that you can look for to identify if a child's having a communication deficit is ask them to tell you about a recent event in their life. And if they can't accurately tell you about a recent event, they may have a communication delay. Can they follow those multiple step instructions? Do they pick up on joking or sarcasm? All of those might be things that could also represent an underlying communication delay. Even if it's not covered with speech therapy, as far as school-based speech therapy, you may talk to your pediatrician and request an outpatient referral to speech therapy to address those broader communication delays. Another thing that you might want to look at is occupational therapy. So occupational therapy can address a wide range of concerns. Primarily, occupational therapy is known for addressing those fine motor delays, things like cutting, scissors, using a pen, that penmanship, those pincher grasps, being able to button and snap. And so kids might refuse to go to school because they can't button their pants, or because they can't open their Ziploc baggie, or because they have a hard time with cutting and coloring and scissors. So OT can help with things like that. But OT is a broad therapy that can help with a wide range of adaptive skills and being able to perform independently across environments. And so you may consider talking to your pediatrician or requesting a referral for an occupational therapy evaluation. Another thing that might be helpful is to refer for physical therapy. Physical therapy is for those gross, broad motor movements. But physical therapy can also address a wide range of concerns, anywhere from not being able to play on the playground because they're having a hard time navigating the playground equipment, whether that's swinging or climbing or running, jumping, hopping. And so if you think about the playground, kids spend a lot of time dribbling basketballs, swinging in the swings, climbing up and going down the slides, or playing foursquare, things like that. And so if a child is having a hard time with their gross motor movements, they may engage in school refusal because the playground or PE or whatever is very aversive to them. And so you may ask for a physical therapy referral from your pediatrician to just evaluate, do we have any of those big motor movements, moving our arms, legs, hand-eye coordination, throwing and catching, that could be leading to some refusal or some aversiveness in the school situation or setting. Another thing that you want to look at is, do we need additional academic support? So if there's any kind of learning disability, or maybe through COVID and those missed years, you have some missed skill acquisition. This can lead to escaping or avoiding academic instruction. I changed schools going from 7th grade to 8th grade. And apparently somewhere in there, I missed learning about percents and how to calculate a percent. I just missed that day in that school transition. And so I remember being very confused in math when we would discuss percents. And it wasn't because I had a math disability. I just missed that day, or I missed that skill. And so sometimes you just need a little bit of tutoring or an after school program to really boost a skill that maybe was missed for whatever reason. Maybe it was a quarantine or COVID, or maybe they just didn't grasp it the first time that it was presented. But maybe they need an initial evaluation for special education And they may need some special or individualized instruction in reading, writing, or mathematics. Another area that can provide some academic support is through a reading specialist or a math specialist. This isn't to the same level or degree of an IEP and needing special education, but it is a preventative service to identify those students who are at risk for failure in reading, writing, or mathematics, and to provide some additional support and additional instruction to prevent academic failure. Another thing that you want to look at is how we can reduce peer rejection. So a lack of motivation in the social environment can lead to a student finding that before school time aversive, that recess time, lunchtime, walking in the hallway, PE, or any of those highly socially loaded situations. And so if you have a student who maybe has social skill deficits or for whatever reason is experiencing bullying, you want to look at how can we provide some additional support for bullying. So what programs do we have in the school and how can we utilize those to reduce bullying? What assistance can we give the student to access that support? Do they need some individual counseling? And so can you access that counseling through school counseling services? Or do they need a referral to an outpatient, maybe professional counselor or some kind of services? And also, can we look at some direct social skill instructions? This is again where the school counselor may be able to help with some social skill instruction through social skill groups, but there are also social skill groups which can be located in your local community, typically by talking to your pediatrician or looking into referrals for social skill deficits. The last thing that we want to look at is providing support for families who maybe have inadequate resources in the home environment. And so can we provide referrals for homelessness or to social services that can help with meeting those basic needs, food, clothing, water, shelter. And so what other resources are there? In the coming days or on our Facebook page, there will be some posts talking about some resources nationally and locally to support homelessness and inadequate resources in the home environment. Thank you so much for watching. I encourage you to follow us at Facebook with Everyday Behavior with Dr. Mary Ann, to visit our website at www.everydaybehaviors.com, or to click the subscribe button by clicking the red button below to receive updates when new videos are released on YouTube. Thank you and have a great day.